Hey, it's Brett again with my next video on concussion rehab. Today's topic is dizziness. Because concussions are a brain injury, that means it is typically more of a central cause of dizziness versus a peripheral one. This means the best course of treatment is to teach the brain habituation. Habituation is teaching the brain to react less intently to movements by exposing the brain to these movements at a high volume. This high volume is really critical for this training. My normal prescription is performing a few dizzy-provoking movements, allowing the dizziness to subside for each movement, and then waiting an additional 30 seconds. This is done 3 times for each movement, 3 times a day, every single day. My go-to way to determine which movements to perform is the Motion Sensitivity Quotient, or the MSQ form. This is a list of 16 increasingly dizzy-provoking movements. I find the first 3 to 4 movements that can cause the patient dizziness and prescribe that with a previously stated volume. Hope this helps treating your dizzy concussion patients. Next time, I'll talk to you about ocular rehab. Thanks, and have a good week.